My name is Alexander Solomon, and this is a PNI Minute. Strabismus is the medical term for eye misalignment. It's commonly known as a squint, a lazy eye, or an eye turn, and patients mostly manifest strabismus by experiencing double vision. And that's because your eyes are misaligned and producing two separate images, like two different cameras pointing in two different directions, so that you get two images that are slightly displaced from one another. The most important thing for strabismus is making sure that there's not a dangerous cause to that. And so that could be something like a tumor, a stroke, or an inflammatory disease that's affecting the brain and those nerves that connect the brain and the eye for positioning of the eyes. Inherently with strabismus, closing one eye will always remove the second image. If you're having double vision that doesn't go away covering one eye, it's typically not coming from a neurologic cause. So the most conservative management is simply, if the patient is comfortable, observation. For patients who have a stable strabismus, we can use prism therapy, which are special glasses that help realign the images so that a patient is able to see single vision, even if their eyes are misaligned at the time. The last thing that we reserve for patients who are stable and are unable to tolerate prism therapy or bothered by the prism glasses or the appearance of the strabismus is a surgery to realign the eyes, where we actually move the muscles of the eyes in order to recenter one of the eyes and make sure that it's lined up with the other one. If you or a family member have strabismus, we'd be happy to see and evaluate them, ensure that there's no dangerous cause to their underlying strabismus, and take measurements to get a baseline. If they're having active double vision and are requesting treatment, we're happy to provide them any prescriptions for any glasses that could help them. And if they've had it for a long time and things are stable, we're also happy to provide a surgical correction for their strabismus.